The NHS is facing unprecedented change and challenge. We have an ageing population, more complex needs. We have a population that is less healthy than it needs to be. At the same time, we have variability of service range and quality across the NHS. Those two factors are being brought together with the financial challenges that we face. So the 20 billion challenge, I don't think will just be for the next 2 or 3 years, but for the foreseeable future. So the financial challenges, the variability of service, and the demands of our ageing population mean that our leaders have to be absolutely fantastic and do remarkable things if we're to ensure that our patients get the best possible outcomes and the best possible experience. We need a more representative set of leaders who in turn can represent their communities to ensure we get the best possible range of services. Our leaders have done a remarkable job over the last 10 years. They've brought huge scales of change, improved access times, tackled a range of new services. But against that backdrop I've described, the sort of skills and styles of leadership will not be as successful going forward as they have been in the past. But there will be additional help to cope. The new NHS Leadership Academy is a brand new national organisation designed to support leaders so they in turn can tackle the challenges I addressed. The NHS is putting into place a whole range of new organisations: clinical commissioning groups, health and wellbeing boards, Health Education England, Public Health England, and of course we'll have more foundation trusts. Now these are all designed to make decision making closer to the patients and ideally by clinicians. Fantastic news for our patients, but of course one of the dangers and risks is that decision making and behaviours become less integrated. And one of the things we do know is that our patients expect and demand our services to be seamless, to be as integrated as they can around their needs. So one of the founding principles of the NHS Leadership Academy is to ensure that we have a fundamental set of leadership behaviours known as the leadership framework, which brings together a STAR approach which pervades the whole of healthcare. Doesn't matter where anybody is in the health and social care system, the leadership framework will affect them. And for the first time, we have an NHS leadership framework which has the support of virtually every single clinical group. It's a fantastic opportunity. So the NHS Leadership Academy will use this framework, and it will ensure that people know what it can do for them. It'll demonstrate the impact of that framework, their leadership style, and the impact on the patients. It'll support individuals from across the system, not just the top leaders, but people from all levels and all clinical groups. And it will help and support those people to be better at what they do. And through leadership, we know that better leadership leads to better patient outcomes and experience. We'll also support local capability by providing support to wherever those staff are to ensure there is, for the first time, a new national system of leadership. And in this way, one of our aspirations is to ensure that we have a group of professional leaders for the first time in the NHS going forward over the next few years.